Human cannabis consumption dates back thousands of years, with archaeological evidence found in the ruins of antiquity. From treating ailments in Egypt, Greece, and Rome, to creating textiles in ancient China, the plant is deep-rooted in history.
If we're going to talk about the history of cannabis, I think it's really important to point out, first of all, that this past 100 years, when cannabis has been something which is illegal, which has been something that's seen as dangerous and with no therapeutic purposes, that's really the anomaly when it comes to human history. In the ancient world, in ancient Greece, in Rome, in Asia, the Middle East, in Europe, cannabis was used for a number of different therapeutic purposes to treat pain, epilepsy, gynecological disorders, to name just a few. It's really, quite similar to what modern science is now finding that cannabis can really be useful for.
I think if you look at the effect of cannabis prohibition over the last century, you can make the case that arguably it's had more damage to more people than cannabis itself ever has. A big part of that has just been the demonization of cannabis and the stigma that's been attached to it. This has meant for countless patients and potential patients, a lot of them have internalized this narrative and have not wanted to try cannabis, or in many cases, it's just been illegal to begin with. But also not just patients, it can also just be recreational users who could potentially find a hobby that could give them some relaxation or enjoyment, but instead they decided not to because they don't want to be criminals or don't see themselves that way. Also, if you look at the United States in particular, but many countries around the world, there's been a very strong racial component to this narrative and to this stigma. So it's really done a tremendous amount of damage. The end result has been that they've been cut off to access to medicine, and also just something that could give them some happiness in their daily life.
While patients and doctors have long used cannabis as a medicine, restrictions during the past century made research hard to come by.
Hard research has been limited in the cannabis space, not only because of the regulatory hurdles that the world's been facing, but as importantly, because of the actual inability to measure what patients are consuming. Now, the majority of patients around the world are using cannabis via inhalation, and there are no actual measured tools that allow a precise dose to be delivered into the human body, and therefore unable to be actually measured and turned into hard science. We had to develop technologies that would automate that whole process and guarantee that the dose the physician prescribed is the actual dose that ends up in the patient's body. And that's critical to do hard science. These tools that we've developed allowed us for the first time to do this in the inhalation space, and it's fascinating.
Now, as regulations continue to ease, scientists around the globe are able to study the plant's varied compounds for a treatment of a wide range of medical conditions.
Unlike consumer products like pharmaceuticals and like alcohol, regulation and research are really underdeveloped. And what this means is there's a massive information gap. We don't know as much as we should know about cannabis, and we certainly don't know enough to make the right laws when it comes to cannabis. And this is why education is so important. Education is going to do the work of breaking the stigma and closing that information gap. There are media outlets like the Cannigma, which are popping up all over the place, bringing evidence-based, credible information about cannabis to everyone who needs it. Cannabis producers are also involved in this education effort, having more detailed labeling so that consumers can understand the products that they're buying and choose what's right for them. And basically all of this is going to come together to break the stigmas, to close that information gap, and to make sure that cannabis has its right place and a more nuanced conversation around it.
When we go to people like lawmakers or doctors and healthcare professionals, and we have, objective, peer-reviewed science and research with us, and you show it to them, you can actually make a difference. Not across the board, not with everybody, but it can help people see things in an objective manner and to kind of chip away at the narrative they've heard.
With many different types of cannabis, the plant has a large potential as a therapeutic drug for a host of conditions and diseases.
Research into precise dosing has brought a lot of surprises. Patients today are consuming about 100 times more of the active ingredient they actually should be consuming. That is really startling outcomes that came out of our research, and we're seeing the benefits of the right way to consume it with our patients today. That is something that I believe will continue on. Patients who consume that paradigm of treatment are able to have more functioning lives, close to zero side effects using cannabis. And we're talking about THC, not just CBD here, and are able to not develop any tolerance and a multitude of other outcomes which just increase our patients' quality of life. They allow to get the maximum effect out of cannabis treatment in that treatment modality. And that's what research has surprised us in actually shining the light of where is this actual treatment dosing range should be.
Diversity in cannabis can be understood by using the metaphor of the wine industry, actually. So we have red wine, white wine, rosé. Me, for instance, I'm a red wine kind of guy. There's little chance I'm gonna drink a glass of white wine accidentally because I can see it's white and not red. With cannabis, it's different because the different types of cannabis and the different effects they can create are caused by a chemical structure that you can't really perceive with your eyes. Now, this is important for physicians, for consumers, for patients, for researchers, regulators, and in fact, they're all linked. For example, a consumer managing expectations from their cannabis experience has to understand the different types of cannabis, just the same as when we look at a glass of vodka versus a glass of beer. We know to expect different effects from them. So nowadays, researchers in the US only have access to a very limited supply of cannabis grown by the federal government. So basically now, regulation needs to catch up with the market reality and give researchers access to a wide variety of cannabis products. So they can create an appropriate body of evidence for physicians to use and make the best choices and prescribe the right treatment, and for consumers to make the best purchase choices.
From memory and appetite to pain, sleep, and the immune system, cannabinoids are believed to help regulate several functions throughout the human body.
The endocannabinoid system is just recently discovered in the 1990s. It's a system that regulates our homeostasis in our body and gives us this wonderful feeling of well-being. It has a very important function in regulating appetite, memory, pain, temperature, reproduction. So the endocannabinoids is a system that is built by three main components. It has the enzymes, it has the endocannabinoids, and it has its receptors. The function of the endocannabinoids is basically the neurotransmitter, or is the chemical that activate the receptors. The receptors are spread all over our body. We have the CB2 in our immune system, the spleen, the connective tissue, and so on. We have the CB1 in our brain and the nervous system. Our body produces by demand the endocannabinoids. But if we have a lock that needs a key, there are keys that we can produce from our own body, but there is another way to get those keys. Those are basically what we get from the cannabis. Consuming cannabis, taking into our body phytocannabinoids. Phytocannabinoids are exogenous cannabinoids that basically lock into the same receptors that the endocannabinoids lock to. Sometimes they will produce similar response and sometimes a different response. But the affinity of the phytocannabinoids to the same receptors sometimes will change the way our body responds to things and produce a different response.
Thanks to developments in science, research, and technology, medical practitioners are learning more about cannabis and how it interacts with the human body, allowing consumers to educate and arm themselves for better decision-making.
In the medical world, we would look to find the exact balance between efficacy and adverse events, and that requires very, very fine-tuned dosing systems. And in the recreational space, the trends would lead into a very safe experience.
Ultimately, education is going to be crucial when it comes to the cannabis industry expanding. And one place we can see that really clearly is when it comes to regulation. If lawmakers properly understand what we now know from cannabis research about the plant, then they're going to be able to make the right laws, which are going to help cannabis businesses and different players across the space really thrive. When cannabis businesses can operate just like any other business, then researchers are going to be able to look into the myriad uses for the plant. Healthcare providers are going to be able to have all of the information they need to be able to treat their patients well. Cannabis companies are going to be able to create new and more diverse products for the recreational space, the wellness space, the medical space, across the board. And cannabis consumers and patients are going to be able to choose the products that give them the cannabis experience that they want.